The latest developments in leukemia research can prove vital for cancer treatments. Leukemia treatment is generally toxic and has several side effects. In this episode, we will explore new treatments that are more targeted and less toxic. But first, please like the video and subscribe to our channel for more such content in the future. Push the bell icon to receive updates every time we upload a video. With progress in immunotherapies and targeted therapies, the treatment for leukemia has more potential to become less toxic and more effective. What is leukemia? Leukemia is a type of cancer that occurs when blood cells mutate. The changes in the DNA hinder the body's natural ability to fight infections. In simpler words, leukemia is a type of blood cancer. Leukemia treatment is divided into two categories, one for adults and the other for children. We will explore both in details. 1. Leukemia treatment for adults. The main treatment for leukemia for the last 2 decades has been chemotherapy, stem cell transplantation, and radiation therapy. However, targeted therapy has also become the mainstay of leukemia treatment. While these treatments can be more toxic, there are still others that can be used in combination to effectively treat cancer, such as CAR T-cell therapy and targeted therapy. What is CAR T-cell therapy? CAR T-cell therapy uses the patient's own immune system to treat cancer. The patient's cells are genetically modified to identify cancer and kill it. Various types of CAR T-cell therapies are used to treat leukemia in adults. Targeted therapy. In this type of treatment, drugs and other substances are used to identify cancer and attack them. Targeted therapy may be used by itself or may be combined with other traditional treatments. 2. Leukemia treatment for children. Just like in adults, the standard treatment for leukemia in children has been treated using chemo, radiation, and stem cell transplant.
Childhood leukemia can be divided into acute myeloid leukemia and acute lymphoblastic leukemia. Compared to adult cancers, the childhood cancers and more so the childhood blood cancers are far more curable.
New treatments such as targeted therapy and immunotherapy are quickly replacing traditional treatments because of their efficacy and lesser toxic nature. An article published on National Cancer Institute (NIH) mentions the following. Standard leukemia treatments for children have been chemotherapy, radiation therapy, and stem cell transplant. Despite great improvements in survival for children with some types of leukemia, some treatments don't always work. Also, some children later experience a relapse of their disease. Others live with the side effects of chemotherapy and radiation therapy for the rest of their lives, highlighting the need for less toxic treatments. Now, researchers are focusing on targeted drugs and immunotherapies for the treatment of leukemia in children. Newer chemotherapy drugs are also being tested. How did you find this information? Please mention this in the comment section. We would also like to know the kind of content you want to watch, and we will try to create it for you. For more news and updates, follow Airr News.